Assalamualaikum warahmatullahi wabarakatuh. Inshallah today we're going to make Ambu ventilation. Now with me now I have Ambu bag and the mask. Okay, first we will explain first about the Ambu bag. So this part is for the oxygen supply, and this valve for it is a valve for airflow during expiration, and this is the side that will be attached to the mask. So we'll attach the mask to the Ambu bag.
You are filming the documentary here?
Yes. So we are when we see an unconscious patient, a patient which has a risk to be having hypoxia. So we'll make the Ambu ventilation. Fix the mask on the face of the patient. Make sure that it is not too big and not too small. The apex should be on the nose and the base at the chin. And we are going to fix our hand to this mask in C and E manner. So C and E, and the E, our finger should be on the ramus of the mandible, and slightly we elevate it and then ventilate. 1 and 2 and 3 and 4 and 5 and 6. 1 and 2 and 3 and 4 and 5 and 6. 1 and 2 and 3 and 4 and 5 and 6.
Okay, this is
Ambu bag.
the mask, and this is the Ambu bag. Do you see the mask? Should be a mask come in different sizes. So it's very important to choose the appropriate size for the appropriate patient. We can use this on the child or anything, no, because it's very large. If you choose the cuff wrong, you are doing an effective breathing, because if it's very too small, it will not fit on the mouth. If it's too big, it will make the air escape. And you see this, you can
Rubber.
Yes, rubber, and it's filled. This is like a seal to prevent the air from escaping. Okay.
It depends on this.
Yes.
This is oral airway. Oral airway.
Yes.
Name? Okay.
Oral
Oral airway.
Okay, we inflate it from here. We inflate the mask from here. Okay, and we put it like this. And this is the Ambu bag. This is the valve that make the air to escape. This is valve. Okay, and this where the oxygen line will be attached. The oxygen supply. Okay, why? Because sometimes the patient is hypoxic and I want to give him ventilation with oxygen. So I will attach the oxygen tube inside this. Okay, how I will do the Ambu mask? Why we'll do it? We want to ventilate the patient. The patient is not breathing, and I want to give him a ventilation until I reach the hospital. This one is present in the ambulance.
Ambu bag.
The Ambu bag is present in the ambulance, so you will ventilate the patient until you reach the hospital. Okay? Yes, it's called an Ambu bag. Yes. Okay, how I will do it? Just putting the mask like this. This is correct. Wrong, because the narrower one.
Should be in the nose.
Yes, the narrower one should be on the nose, and wider one should be on the mouth. Do I ventilate like this?
No.
Yes, yes.
Slightly
Do you see when he fixes it? Okay, but I have a technique on fixing what's called the C and E.
C and E.
C, just C. This is the C. To prevent, yes, C and E.
Okay.
And the E is pulling the angle up.
Angle.
The mouse,
Mandible.
The mandible up. Yes. Do you see? Do you see the difference?
Oh.
Okay, and different position. Okay, so I have a very small hand. This is the C, and this is the E.
Wow.
Try to do the C and E with your right hand and the left hand doing the ambu. Yes, like this.
ده فين
ده عشان اعمل انفليشن
اوفر
So this is the E and this is the C and this is the E. Okay, and I can ventilate it like this. Okay, or like this. I'm standing beside the patient. Okay, I will do the ventilation like this. Or what? What is the rate? I must know the rate. No. 10 per minute. How I calculate the 10 per minute? I do one. I give first 3. 1, 2, and 3, and 4, and 5, and 6. 1, 2, and 3, and 4, and 5, and 6. 1, 2, and 3, and 4, and 5, and 6. 1, 2, and 3, and 4, and 5, and 6.
That fast?
This is not fast. This is good. Counting? No. 1, 2, 3, 4, and 5, 6.
Oh,
Yes.
1, 2, and 3.
1, 2, 3, 4, 5, 6.
1, 2, and 3.
Because I want to give 10 per minute. The minute 16. When I
6 seconds.
So when I count 1, 2, 3. Give 1. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. Because it's very important not to hyperventilate the patient or hypoventilate the patient. This is hyperventilation. I'm washing the carbon dioxide of the patient. Or
And what is the effect of hyperventilation?
hyperventilation, the CO2 will accumulate. It causes more.
Oh, hyperventilation.
هو يطلعه منين؟
Bila banyak keberusahaan dia akan
The
bahaya.
CO2 escape from the
Memudahkan heart rate, increase heart
valve.
rate.
This is called a valve ventilation from the valve. The air that the patient expire from the valve.
And this valve is called ventilate.
This is called the valve.
The valve.
This is valve.
Carbon dioxide.
Valve. Okay. So the exam the question in the exam will be what is the ratio of the ventilation. When we do it in the exam, you just put the mask and do the C and E and start 1, and 2, and 3, and 4, and 5, 6. 1, and 2, and 3, and 4, and 5, 6. 1, 2, and 3.